Hello dear friends, and welcome back to Levitas, your trusted information source for weight loss, health, and wellness insights. Today we're discussing frequent urination at night, known as nocturia, which can be quite disruptive to your sleep and could mean something is wrong with your overall health quality. So, come on and join us as we get into learning into a topic that affects many individuals, particularly as they age or deal with certain medical conditions. Let's begin by exploring how nocturia is related to prediabetes and diabetes. Nocturia is commonly seen in individuals with these conditions, as high blood glucose levels can lead to an increase in urine production. As a result of high blood sugar, individuals with prediabetes or diabetes may experience more frequent trips to the bathroom during the night. This happens because excess glucose in the blood can pull more water into the urine, leading to larger volumes of urine and more frequent urination. When blood glucose levels are poorly managed, the kidneys work harder to filter out excess glucose from the bloodstream. And this may result in kidney damage. This process requires more water, which can lead to an increase in urine production, especially during the night when the body's regulatory mechanisms are less efficient. Understanding the relationship between nocturia and diabetes is crucial for managing the condition effectively. Properly controlling blood glucose levels can help reduce the frequency of nighttime urination and improve overall sleep quality. Let's discuss how to fix frequent urination at night, especially when it's related to prediabetes and diabetes. Blood glucose management. The most important step is to manage blood glucose levels effectively through a healthy low-carbohydrate food plan, regular exercise, and medication, if necessary. Timing of fluids. Consider adjusting the timing of your fluid intake throughout the day. Avoid consuming large amounts of fluids in the evening to reduce nighttime trips to the bathroom. Aim to finish drinking your hydration goal for the day at 7 p.m. tops. If you feel thirsty after this time, drink your liquids with moderation, only what is necessary. Lifestyle changes. Adopting a healthy lifestyle that includes a healthy food plan that is more a low-carb food plan, regular exercise, and stress management can improve overall health and potentially reduce nocturia. Avoid stimulants. Limit late intake of urination stimulants like the ones we discuss next. Spicy foods. Spicy foods may irritate the bladder and cause increased urination or urgency in some individuals. Artificial sweeteners. Some artificial sweeteners can irritate the bladder and increase urination. Citrus fruits and juices. The acidity in citrus fruits like oranges, lemons, and grapefruits can irritate the bladder and lead to increased urination. Tomato-based products. Tomatoes and tomato-based sauces may irritate the bladder and cause increased urination. Carbonated drinks. Carbonated beverages, including sodas, can irritate the bladder lining and increase urination. Medications. Certain medications such as diuretics known as water pills, can increase urine production. Always consult with your head healthcare provider before making any changes to your medications. Chocolate. Chocolate contains both caffeine and theobromine, which can stimulate urination. Certain herbs and supplements. Some herbal supplements, like dandelion and juniper, may have diuretic effects and increase urine production. What medications produce nocturia? Nocturia, or frequent nighttime urination, can be a side effect of certain medications. These medications may increase urine production, irritate the bladder, or affect fluid balance in the body. Here are some types of medications that can produce nocturia. Diuretics. Also known as water pills, diuretics are commonly used to treat high blood pressure and heart failure. They increase urine production and are typically taken in the morning to avoid nocturia, but if taken too late in the day, they can lead to nighttime urination. Alpha blockers. These medications are used to treat conditions like benign prostatic hyperplasia, also known as BPH, and high blood pressure. They relax the muscles of the bladder and prostate, which can potentially cause increased urination. Calcium channel blockers. Used to treat high blood pressure and other heart conditions, these medications may affect bladder function and lead to increased urination. ACE inhibitors. Angiotensin-converting enzyme inhibitors are used to treat high blood pressure and heart failure. They may cause nocturia in some individuals. NSAIDs. Non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen may irritate the bladder or affect fluid balance, potentially leading to nocturia. Antidepressants. Some antidepressants, particularly those with anticholinergic effects, can cause urinary retention or increased urination in some individuals. Antipsychotics. Some antipsychotic medications may affect bladder function and cause increased urination. Beta blockers. Used to treat high blood pressure and other heart conditions, beta blockers may have an impact on fluid balance and urine production. Lithium. This mood stabilizer is used to treat bipolar disorder and can affect kidney function, potentially causing nocturia. Corticosteroids. These medications can cause fluid retention, which might lead to increased urination. Hormone replacement therapy. In some cases, hormone treatments may affect bladder function and increase the likelihood of nocturia. Muscle relaxants. These drugs can sometimes interfere with bladder control and increase urination frequency. If you are using any of these medications and experiencing nocturia, talk to your head health provider to regulate the dose and have a check on intake timing. Nocturia, or frequent nighttime urination, can be caused by a variety of medical conditions other than prediabetes and diabetes. Here are some other conditions that can lead to nocturia. Benign prostatic hyperplasia. An enlarged prostate can press on the urethra, causing bladder irritation and increased need to urinate, especially at night. Overactive bladder. This condition involves frequent, urgent need to urinate, which can continue through the night. Urinary tract infections known as UTIs. UTI can cause irritation and inflammation of the urinary tract, leading to increased frequency of urination, including at night. Chronic kidney disease or CKD. Impaired kidney function can lead to an inability to concentrate urine properly, resulting in increased urine production and nocturia. Heart failure. When the heart doesn't pump efficiently, fluid can accumulate in the body and shift when lying down, causing the kidneys to produce more urine at night. Sleep apnea. Obstructive sleep apnea can cause fluctuations in blood pressure and heart rate during sleep, which may stimulate the kidneys and lead to nocturia. Medications. As previously discussed, certain medications like diuretics can increase urine production and lead to nocturia. Interstitial cystitis. This chronic condition causes bladder pain and pressure, leading to increased frequency of urination, including nocturia. Hormonal imbalances. Changes in hormone levels, such as those experienced during menopause or due to hormonal disorders, can affect urine production and bladder function. Neurological disorders. Conditions such as Parkinson's disease, multiple sclerosis, and stroke can affect the nervous system's control of the bladder, leading to nocturia. Sleep disorders. Poor sleep hygiene or other sleep disorders can disrupt sleep patterns and contribute to nocturia. Prostate cancer. In some cases, prostate cancer can cause urinary symptoms, including nocturia. Obstructive uropathy. Any condition that causes obstruction in the urinary tract can lead to difficulty in emptying the bladder completely, resulting in the need to urinate more frequently, including at night. Pregnancy. During pregnancy, hormonal changes and pressure from the growing uterus can lead to increased urination, including nocturia. Anxiety and stress. Psychological factors like anxiety and stress can affect bladder function and lead to increased urination. In conclusion and to summarize today's video, we have explored the topic of frequent urination at night, also known as nocturia, and how it can be linked to prediabetes and diabetes. Nocturia is a common concern, especially for individuals with these conditions, as elevated blood glucose levels can lead to increased urine production and more frequent trips to the bathroom during the night. Nocturia impedes you from having a good night's sleep. We began by discussing the relationship between nocturia and prediabetes and diabetes. High blood glucose levels can affect kidney function, leading to increased urine production and nocturia. Properly managing blood glucose levels through a healthy food plan, regular exercise, and medication can help reduce the occurrence of nighttime urination. We provided several strategies to help fix frequent urination at night, particularly when it is related to prediabetes and diabetes. These include: keeping blood glucose levels in check is crucial in managing nocturia, as it directly affects urine production. Being mindful of fluid intake, particularly in the evening, can help minimize nighttime trips to the bathroom. Adopting healthy habits such as regular exercise and stress management can improve overall health and reduce nocturia. Avoiding urination stimulants. Certain medications can contribute to urinary frequency, so it is essential to discuss medication adjustments with your healthcare provider. We also touched upon other potential causes of nocturia, such as bladder irritability, urinary tract infections, and prostate issues in men. Addressing these underlying conditions can help alleviate frequent urination at night. Overall, managing nocturia requires a comprehensive approach that encompasses blood glucose control, lifestyle adjustments, and medical management. By taking these steps, individuals can improve their sleep quality and overall well-being. It is essential to consult with a healthcare provider for personalized advice and treatment options tailored to your specific situation. As with any health concern, early intervention and proactive management can lead to better outcomes and enhanced quality of life. By implementing these simple tips, you can take control of your health, stop nocturia, and at the same time improve your sleep quality. Thank you for tuning into Levitas. If you found this video helpful and informative, be sure to share it with your friends and family, give it a thumbs up, subscribe to our channel, and hit the bell icon to receive notifications for future videos on weight loss, health, and fitness content. Also, leave a comment sharing your questions, thoughts, and experiences with nocturia. We love hearing from you. Your support is very appreciated. It helps us grow and create even better content for empowering you to achieve a better body and optimal health every week. Remember to fuel your body with the right nutrients, stay consistent with your training, and keep striving for your fitness goals. Until next time, remain tuned to Levitas for more expert advice to help you on your health and fitness journey. So, stay healthy, stay happy, and keep going.